Hello, it's Jenny is back from America here in Nowheresville, America, in my hillbilly state. Wanted to give you my take on Child D. First of all, just wanted to give you just as a review for you, just always keep in mind that usually when a baby with a premature rupture of membranes gets infected, it's usually from the mom's flora, which would be a group B strep and E. coli. And that usually does respond pretty well to both a penicillin and a gentamicin, a combination of two antibiotics. But it's looking like, and if Michael McConville's hypotheses are correct, that it looks like the reason the baby did not respond to the antibiotics and succumbed in a very awful way was probably that the baby was exposed to Pseudomonas, either prior to birth or right after birth. And basically, if we can review, Pseudomonas is what we would call some sort of like a super pathogen, much worse than group B strep and E. coli. And the reason it is that it creates this biofilm that protects it. Not only does it protect itself, it's hard to clean it up. It's hard for antibiotics to get there, but it also invites other pathogens in, which could have been either that E. coli or that group B strep, and that actually supercharges those bacteria too. So the poisons that bacteria puts out, it would have made it more poisonous than it normally would be. Now, what we have just found out through that recently leaked document that a nurse, Carolyn Oakley, a colleague of Lucy Letby, had wondered after the death of Baby D if maybe the baby died because her cot was literally very close to it was some sort of a ceiling sewage drainage that came down. Remember they had to put nappies into the ceiling to collect it. And it looks like the cot was close to a sewage drainage. Just as a background, mom was basically left with premature rupture of the membranes for 60 hours. Usually, if the membranes rupture, you want labor. A lot of times the membranes will rupture after labor has started, but if it does beforehand, you kind of want to make sure that labor starts within 12 hours. Then you start getting a little bit nervous as you're getting closer to 18 hours, and then definitely alarms and sirens should go off around 24 hours. That's usually kind of a mark. Now, whether, I don't know what the protocol was back then in 2015 as to when do you give antibiotics prophylactically for the mom during labor, but definitely definitely in 2015, there would have been some sort of protocol and they ignored it. Basically, it looks like also, from what I can tell, I listened to a recent interview with Martin Pittman. Back in the 2015 era in the NHS, there was a push, and he believes as an obstetrician it was too much of a push for women to deliver vaginally and to keep the C-section rate down as low as possible. There were statistical, studies done and to keep it down. And I can even remember that the NHS was touting the fact that it had low C-section rates and the fact that America here had much higher C-section rates. It's looking like now that the C-section rates have dramatically increased because it's looking more and more like that the NHS should not have had such a strong policy for vaginal deliveries and essentially to put off the C-sections, and the C-sections in many cases probably were warranted. And I am even wondering if that might have had an effect on your all these maternity scandals than in other hospitals too. Now, what I find just really amazing in my time, that even though I was never a labor nurse, I did do chart auditing for our maternity department, and I would have to enter the maternity department in order, to get whatever I needed done. What I would always see, and I am confident that this would have definitely also been in the United Kingdom, is there in a maternity department, in a laboring department, there's a big board with the names of all the moms, their gestations, how many babies they had, if there was any issues with the pregnancy, and all this other information. But on that board is always put the time that the membranes have ruptured. So it's with 60 hours. What is that? How many days is that? That's several days went on, and how many shifts of midwives there were, and obstetricians that were there, and trainee doctors, that no one took notice of the time that this membranes was ruptured. It is really, really sad. Mom was sent home for a while to see if labor would start, and then when she came in, she was left in the waiting room for a long time. They did do induction on her, meaning they give you medication to start your labor, and it looks like her labor never really took hold per se, and she kept asking, and she basically felt as if she was being ignored too. I also have to question if the Countess of Chester, in a labor saving cost, they culled so many of their advanced practice nurses and experienced registered nurses, during the time of Michelle Ward. And I'm wondering if everything tells me that they probably did the same too. And I am assuming that the maternity department was probably just as pathetically understaffed as the neonatal unit. So I don't want to put too much pressure on these poor midwives. Also, as a back information too, the CQC has noted it for several years, that the Countess of Chester only had what they would call one surgical suite. I know you call it a theater, for their C-sections. And they even mentioned that every hospital, no matter how small, they always have two. That way you always have one available in case you need to do an emergency C-section as one is going on. That is, I believe we may at my hospital had two theaters too. But apparently the Countess of Chester they did have used back rooms that they would use as a just in case. And again, were these rooms being as cleaned as well as the surgical theaters too? I also have to question if her C-section was put off just due to the fact that maybe there was a backlog of moms that needed a C-section on that shift too, and I had to try to get to her. Once they determined she did need a C-section, though, it sounded like they moved quickly, so they had to be seeing something on that poor monitor. And I do believe the mom basically begged for a C-section. Also, it looks like there was no neonatal team at the C-section, and I believe that is standard practice to have a neonatal team or some sort of a pediatrician or something at the bedside when the mom delivers when it's a C-section, because there are so many more complications you can have with a C-section versus a vaginal delivery. And it looks like there was only one midwife there, and God only knows how that poor midwife was probably overwhelmed with what was needed to be done. Now, also, just as a side note too, after this baby had died, Lucy had texted someone to the effect that they were thinking that baby D died due to meningitis, and she was questioning that nurse to see if baby had a lumbar puncture, which would have been a normal thing to do in a severely septic baby. Once they're to some degree stable and not moving, you do, in many instances, although not all, do want to get a lumbar puncture, a spinal tap, to see if maybe whatever's going on with the sepsis, if it had progressed onto the brain, which is, the blood-brain barrier on a neonate is much, much, much lower than it would be for an adult. And a blood-brain barrier is kind of as a protectant to keep poisons and pathogens and other things kind of away from that, the most important organ of your body. Now, so baby was definitely born with what we would call a congenital pneumonia. And what that means, congenital, is it was born with a pneumonia, meaning the pneumonia formed before this baby was even while the baby was in the womb, before it was even born. So it was born with a pneumonia. Now let's just kind of backtrack on what the inflammatory response is. Basically, anytime there's any kind of an assault, be it a pathogen, be it you bump your leg on something, you twist your ankle, you cut yourself, you're going to have what we call an inflammatory response. Uh, what the body does is, first of all, it's going to kind of what we call increase the permeability of the blood vessels, meaning make them more, shall we say, leaky, because you're going to want to get a lot of things to that site. You want to get special white blood cells in order to fight what would probably be an infection. You want to also get what we call clotting factors there too. So, and you also increase the lymph there too. I don't know if you've ever had, as you've seen it, you've had a cut later on after the bleeding stop, you see some clear liquid. That would be the lymph, and that's all part of the inflammatory response. Well, also what you do is you get clotting factors too. You want to stop the bleeding. If there is a bleeding assault, so you do you bring in stuff too that will eventually clot too. So keep that inflammatory response in mind, because later on I'll explain the baby went into something called DIC. Now, Pseudomonas is known. Again, we know that, again, it could make pathogens and bacteria that normally would respond to antibiotics super. But it's also associated with meningitis, and it's also associated with the lung injury, that extreme lung injury that I talked about in my previous video 2 days ago. It's associated with so severe that you would form what we would call a hyaline membrane, meaning there's a lot of junk there. You can't produce a surfactant. Your little tiny little end things there, the gases where the carbon dioxide and oxygen is exchanged. It can't be exchanged because those walls of that is too stiff. Just as a side note, I had a baby that was very septic when she was born, but it was only group B strep. And she responded beautifully to antibiotics and responded exactly as she should. Probably because, in addition, she was not exposed to Pseudomonas. Now, basically what happened is that this baby was limp. Basically, when they showed the baby, what they'll do is when they have a C-section, the mom can't really see what's going on. There's a curtain right there. What they'll do is they'll lift the baby over and kind of show the mom real quickly right after the baby is taken out of the womb. And she even noticed, and this was a first-time mom, that the baby was limp. And then the baby was then given to dad to hold, and at 12 minutes of life, it basically became limp again in the dad's arms, which is just so sad. The baby was sent back with the mom in whatever the recovery area is, and mom noticed the baby wouldn't feed. She had to ask several times for a pediatrician to see, and finally on the second time, the pediatrician finally saw it and went, oopsie, we got a real problem there. And that baby was 3.5, almost 4 hours old. So you can imagine just, the time that was lost. When that baby was admitted to that unit, it was already jaundiced. And that is absolute sirens to me. It should be to anyone. And anyone, I don't even have neonatal experience, and I know that is just a horrendous thing. Now, normally babies do get jaundiced. It's a very common thing a few days after life because their liver is immature and stuff. And all you do is put them under these little lights, and as long as the levels go down and not up, everything's fine, and it usually resolves in a day-ish or so. Both of my babies were jaundiced, and I would imagine that many of yours were also there. Well, this baby was so jaundiced, it needed 3 lights. Now, what's telling me again, it's like all the doctors did was put it under lights, and I don't even think that they really did an in-depth. Less than 24 hours means that there is red blood cells that are being destroyed. So why are they being destroyed? Well, the baby was septic. Also, jaundice in that 24-hour period it definitely is a huge marker for sepsis. And other things, it could be a marker also for what we would call incompatibility. The baby's blood didn't match the mom's, or there's some other immunological things. But again, you would definitely want to work this up for as a septic situation. Also, the baby was put on CPAP. It didn't get better. So by the next day, it was actually had to be intubated and put on life support for that because of various things. Now, Michael McConville believes that this was the time that baby should have been transferred to either Arrow Park or Liverpool Women's Hospital. And since it wasn't, there was just no hope for this baby. Baby actually ended up succumbing within 36 hours and ended up in the end, as he is theorizing, it had prolonged coagulation times. What that means is that the blood is not clotting correctly. The liver is not functioning. It's not putting out what it needs. In addition, although also the blood is not doing what it needs to clot. And when you have prolonged coagulation times, that is a marker for incoming what we call DIC, and that's disseminated intravascular coagulation. And and I hate to say this, nurses, what we call this is death incoming, DIC, meaning death will come soon. And it's a sad kind of a situation we have. And I hate to say this, I don't want to be crass or anything like that, but when we see certain diagnoses, we have various nicknames for them and stuff that obviously we would never say in front of any sort of a family situation, but kind of we think it to ourselves. Now, at me as a chart auditor, this is what I can do for you here. Brewery, and again, this is a sign of a man that is obviously is just stressed out. I don't think he knows what he's doing. He knows he's got to hide all of this. He knows that his job is on the line, his career is on the line, everything's on the line. There is definitely will be incoming, definitely parents are going to look for lawyers for compensation. This was the baby that should not, out of all the babies, should have survived. So he basically has done a series of reports for various in and out of the hospital boards and stuff like that. And Thorold has published some of these. And this is, again, me as a chart auditor, I can kind of read behind the lines. And actually, I can point out to you here how he is lying by omission and what I am seeing as a chart auditor. Let's start with this one here. Basically, it looks like this was probably again, day 2. Baby was born, I'm going to guess baby was born around the 20th or 21st. And, I think it died it died, 4 a.m. on the 22nd. So this is the evening before it died. Basically, it's saying that rising lactate. And that's telling us here, lactate is a sign of acid. So we do know that the baby went into something called respiratory acidosis, meaning it could take in oxygen, but it couldn't blow off carbon dioxide. And it's due to the fact that those little tiny air sacs are being blocked or stiffened. And when you have a buildup of carbon dioxide, it puts acid into the blood. Now it's saying here slight delayed capillary refill. What that's telling us here is that basically that the blood flow to the skin, if the blood flow to the skin is being compromised, well, you can imagine it's being definitely compromised to all those important organisms too. And it says feet purple and bruised. Well, again, that's a sign, and what I'm going to explain DIC to you. It's basically that normal inflammatory response that I told you about, where you have increased permeability, swelling, clotting factors and stuff. So basically, the baby is probably, and again, what it does is that the inflammatory response goes on overdrive. Instead of like what we would call throwing a grenade at the situation, it starts throwing a flamethrower and eventually an atom bomb. It can't stop itself. So it's basically it's going to you're going to bleed a lot. Then your body's going to try to throw in a ton of clots and try to clot that, or clotting factors that you throw in a bunch of mini clots, and then you use up the mini clots, and then you bleed again. It's a cycle that is just it goes on in a cyclic measure. And in some parts of the body you're clotting, and other parts of the body you're bleeding. So again, it's going haywire everywhere. So this basically that purple and bruised, that's the bleeding underneath the body, underneath the skin too. And that crazy rash that they were talking about, that quote unquote Dewey was saying was air embolism, that was little petechiae. Those were little tiny bleeding under the skin. Now it says irregular respiratory effort. Yes, that would happen in a baby that's not breathing well. Some DSATs, meaning a baby did have some periods where the oxygen was going on. And then I'm seeing something here that I've never seen before. At 9 o'clock, it had something called, you see there, hyponatremia. That's low sodium. That is a classic sign of sepsis, a classic sign of, and sometimes what happens in sepsis, your body just fills up with fluid. So your sodium becomes diluted. Also, you don't put out the correct hormones of that too. It also could be a sign too that they are in an attempt to stabilize that baby. They may be giving it too much IV fluids. We don't know. But they're claiming now that there's no respiratory distress, no abnormal gases. Well, it's a known thing that happens in adults, and I'm now finding out it happens in neonates, that sometimes during the dying process, your body will give it its all. And literally, for a short period of time, you appear to be stable before you then crash. It's like you're trying to throw everything at it, and it's kind of you almost like awaken before. And I guess think of it as a last gasp, and until basically you crash and die. And then we see at 1:40 in the morning, again, discolorization would come back. Of course, you would collapse, and then the baby arrests. Now, the second one here, you can see the second report here. He's saying pneumonia with acute lung injury. Yeah, that's saying that's that hyaline membrane that the pathologist found on postmortem. Premature rupture of membranes from 36 weeks, 0.6, delivered at 37 weeks. No antibiotics given before delivery, correct. Dusky episode at 12 minutes, like I said. Probably should have led to admission to the NICU then. Absolutely. And you can see here, he's owning up to the fact that it took 3.5 hours for them to get that baby in. You can see, and it says arrest and deterioration on day, whatever. And then group felt, and I guess it was a group of their consultants. The consultants in the group said it felt initial delay in starting it by antibiotics very unlikely to be contributory to death. I am calling total bullshit on that. And again, the baby was probably only given ampicillin, which is a penicillin, and gentamicin, and those would have covered the group B strep or the E. coli, the normal flora that's in the mom's body. But it definitely would not have covered at all, could not have had any effect at all on Pseudomonas, or if there was something called Klebsiella. Both of those things are present in sewage, and we do know the maternity ward had a lot of problem with sewage. Uncertain cause of deterioration after initial improvement. Again, yes, the baby, again, a human being at many times rallies right before they then crash and die. The UVC, that's the umbilical IV line, was withdrawn to a low position. I have no idea why they did that. Contrary to draft, I guess that's British that's some sort of like an important perinatal medicine guideline organization. So it looks like they didn't have guidelines at either the Congress of Chester or Liverpool as to what to do or where to put these UVC lines. I find that unbelievable. Those places should have guidelines for everything. Why they didn't, I don't know. And they're saying that basically pulse oximetry, that's what you use. It's that little light bulb thing you see on someone's finger that you probably had that can kind of measure oxygen. It looks like it might have helped some sort of that with that. And again, here's another, on the top, there's another, right here, there's another thing here of some sort of report he had. And it says basically, again, it says floppy and apneic at 12 minutes of age. Yeah. Initially responded, and again, it looks like they gave it IV antibiotics. Oh, and it looks like it gave it an IV fluid bolus. If they gave it an IV fluid bolus, that is a sign that they know that that baby, again, with sepsis, your body, again, the blood vessels kind of dilate and they become more permeable, meaning fluid can leak out of them. So you're doing something called third spacing, meaning it's not staying in the blood vessels to keep your blood pressure. It's going out into the skin. And think of it as your body's swelling. Received mechanical ventilation overnight and respiratory status improved. Michael McConville called bullshit because literally right after they took that baby off of mechanical ventilation, there are nurses' notes that says it went into respiratory acidosis. And again, that's telling us it's maintaining carbon dioxide. And they put it on CPAP, and for some reason, they took it off CPAP too. Again, these trainees are trying to what they call wean this baby off of mechanical ventilation. Yes, you want to wean a person off of mechanical ventilation, but there are set protocols and set ways to do it, and you do it under a very carefully monitored, somewhat slow process. And again, how we would, if you would have major surgery and you're on life support, following the surgery, again, how nurses wean and doctors wean you off this life support. It's a very wonderful stepped process. And it looks like these trainees didn't know what they were doing. And again, I can see everything here, unstable with blood markers for infection too. Again, they were not monitoring all this in a set fashion that, again, there are set protocols and you are taught this as part of your training. And again, where are the consultants? We know that's not. Now, this bottom one here is very interesting. They went through let's learn from our mistakes situation. And it's basically, here's what he's saying. And I found this fascinating. And it says, here he's learning from Baby D's mistake. So possible indication for admission to the neonatal intensive care unit after floppy episode at 12 minutes of age. Perfectly sound. Possible indication for admission, again, was missed. So it was missed the first time at 12 minutes of age. It was missed the second time at 1 hour of age due to the baby's temperature was low. Again, a classic sign this baby's in trouble. And grunting. Classic sign again, when a baby grunts, it's basically doing things to try to improve the gas exchange in its lungs, and it just automatically does it without even thinking. So it'll do this grunting things as a way to improve pressure in its lung, as a way to expel what it needs to expel. Cardiovascular, it's noted now, they see this, cardiovascular instability at time of extubation. Extubation is when they took that baby initially off that ventilator. It was there in their face and they still extubated this baby. They took it off, that throat tube out of it, took it off of mechanical ventilation. Now, this is really interesting here. So antibiotics. So normally Benpen, that is your penicillin, and this is your gentamicin. Those are the normal things that you would give a baby, thinking that that was given to my baby when she was exposed to my flora and became septic. But look at here. Now they're going to go and add to their protocol. This antibiotic here. And what this antibiotic is giving here, I believe it's a 4th generation cephalosporin. Anyhow, basically, this is an antibiotic that you would give when you think a baby has severe sepsis, meningitis. But this is telling me a lot here. Again, you want to always tailor your antibiotic to the pathogen you believe it is until you get your cultures back, which would take a couple of days. E. coli, Klebsiella, those are things there that are highly, highly present in what? Sewage. So they knew this baby was exposed to sewage. And again, this is a good medication here. They like it too because it crosses that blood-brain barrier. And it's also good for bacteria that's resistant to penicillin. Oh, so they know there's a problem. So anyhow, I will, again, do a part 3 coming up too, just to add to this, because this has just gone on past, I don't like to go on past 30 minutes. So again, you see anything, you Datix me if you have any concerns or questions, if you feel that whatever information I am giving to you is incorrect. I love to correct myself. I love all of your comments. I get more out of them than I think you get out of me. So take care. And again, this is just sad situation. And this never should have happened. FYI, this parents were the first ones that requested their medical records, and it was done as early as 2015. And I believe this might be one of the babies that the inquest was halted due to quote unquote Operation Hummingbird. But please let me know if that is incorrect. I believe it might also be the triplets, the two of the O and P might be, and this one too. Those inquests were put on hold, I believe, due to Operation Hummingbird. Again, just the saddest situation. You all take care. Bye-bye.